Well, the American Civil Liberties Union is suing the Bureau of Prisons, claiming the agency is concealing documents detailing how it handled the COVID-19 pandemic. To date, 127 federal inmates have died from the virus, including 2 at the complex in Terre Haute. Adam Pinsker spoke with a woman whose brother was almost a statistic.
Jimmy Davis has been incarcerated at FCI Terre Haute now for 10 years after being convicted of robbing a bank in Oklahoma. His sister says Davis almost died after contracting COVID-19 here at the prison last month. According to a letter that he wrote to his sister Sharon Harneman, inmate Jimmy Davis started showing symptoms of COVID-19 in late August, including loss of taste, appetite, and smell.
He said his lungs felt like they were on fire. He said that in the back of his head, it felt like a hammer was beating on the back of his head.
Davis was transferred from the medium security facility on the complex to a quarantine cell on the maximum security side, where his sister says Jimmy received very little medical attention.
He begged them to take him to the hospital. He was in so much pain, but that request was denied. So they just left him in his cell, gave him no antibiotics.
Harmon, who contacted our City Limits project about her brother's case, says she thinks it's a miracle Jimmy survived, considering he already has health issues and is a liver transplant recipient.
He had written a letter to me that he asked me to bury him beside Mother. Jimmy truly believed he was going to die.
But 2 of Davis's fellow inmates in the same facility weren't as lucky. Tim Hocutt died from coronavirus September 14th. A day earlier, another inmate, Dale Bird, also died from the virus after being taken to a local hospital. We asked the Bureau of Prisons for comment on what it is doing to ensure the safety of inmates and staff at its facilities. It responded in a lengthy email with an outline of its 9-phase COVID-19 action plan. On January 20th, the agency initiated Phase 1 by establishing a task force to examine how the Bureau would respond to the pandemic. On March 13th, it initiated Phase 2, which suspended in-person social and legal visits and curtailing inmate movement within its prisons. Phases 3 through 5 imposed a 14-day quarantine on inmates entering the prisons, limited inmate transfers, and imposed strict temperature checks on staff and contractors. But the chief federal public defender for the Southern District of Indiana, Monica Foster, questions why there are still COVID cases at USP and FCI Terre Haute if these procedures are being followed.
My information from inside the prison is that they're not wearing masks uniformly. That in some instances, even the medical staff is not wearing masks.
On August 31st, the Bureau of Prisons resumed family visits, but Foster says she's not letting her public defenders visit inmates in person until positive cases decrease to near zero, and it is a decision she does not take lightly.
It's very, very difficult to develop a trusting relationship over the phone. And a trusting relationship is sort of the core piece of the attorney-client relationship.
Foster says she is extremely concerned about what she thinks is a lack of transparency from the Bureau of Prisons about conditions inside its facilities. For Harmon, she says she had to keep calling the Terre Haute facility before getting any answers about the status of her brother.
You get no word from anyone. No one even contacted me to let me know that Jimmy had COVID-19.
The Bureau of Prisons says that during the pandemic, visits are non-contact and social distancing is strictly enforced. It also says that inmate phone minutes have been increased from 300 to 500 per month and that those calls are free for the inmates during the pandemic. Reporting for Indiana Newsdesk, I'm Adam Pinsker.